All right, so today we have with us Dr. Ron Weiss. He's known as a physician farmer, and he grows his food that he prescribes directly to his patients. He's been covered in the New York Times and on the Today Show, and his patients fly in from thousands of miles away to seek medical care from him and his team because they're interested in lifestyle modification, not pharmaceutical medication. So Dr. Weiss is also an assistant professor of clinical medicine at the New Jersey Medical School, and is the founder of Ethos Health, the first farm-based medical practice in the country, which we're going to be hearing a lot about today. To say that Dr. Weiss is unique is an understatement. He's a brilliant doctor with an attention to plant-based nutrition that has helped countless people regain total health. And he's a member of our all-star nutrition team. Thanks for being here today, Dr. Weiss.
Well, it is my pleasure. Thank you for having me.
So you, Dr. Weiss, you have an amazing story that got you into plant-based nutrition in the first place. So could you tell our listeners what your personal story is?
Yes. I went to college here in New Jersey from Rutgers. I got a botany degree, undergraduate, and then I went on to medical school at Rutgers, New Jersey Medical School, got an MD degree. Did my internal medicine training at George Washington University Hospital in DC. And about a year after I graduated from all of this academic conventional training, my father was diagnosed with end-stage metastatic pancreatic cancer, suddenly, much to our shock and chagrin. And we took him to the best cancer hospital in the world. He was given about 1 to 3 months survival. It was very late. Most of his liver had been obliterated with tumor by this time, and it was all over his abdomen. He basically wasn't given much of an option other than 5-fluorouracil, which was the primary conventional treatment at the time, had an 85% no response rate. Nothing would happen. 15% chance that maybe the tumor would shrink slightly. And my father decided to go home and, get his affairs in order. And because, I was, our whole family was overwhelmed. I was a newly minted doctor. I treated a lot of these pancreatic cancer patients in my oncology training and internal medicine. And, I knew how bleak it was. Being so overwhelmed and frustrated, and knowing that there was nothing in my world that I knew that could help my father, I randomly walked into the public library in our town, and I started to just go through the shelves looking for alternative methods, and came across all kinds of books from, Chinese medicine and acupuncture and, shark cartilage, Laetrile, all kinds of things. Some of them seemed a little strange to me. And the thing that seemed most, familiar was food. And I came across a book of cancer patients who had given testimonials regarding a macrobiotic diet and their success with it. And some of them had cured their cancers. And macrobiotic diet, for those who don't know, is a type of a whole food plant-based diet. I showed my father this material. We started him on the diet. He did amazingly. And by the way, he did have type 2 diabetes for many years. I'd say for about, maybe about 10 years preceding his diagnosis of pancreatic cancer. It was treated with oral hypoglycemic agents. And within days of going on a severe plant-based diet, which was very restricted, he basically lost all of the pain he had, started eating again. His pain vanished. He went back to his law office. He was an attorney about a week after starting the diet because he felt so well. He started running the next week, went back to the gym the week after, and everything just kept getting better and better. About 3 months, after starting the diet, we obtained a CAT scan, which showed a 1/3 reduction in his major tumor masses. 9 months later, a second CAT scan showed a 50% reduction in his tumor masses. And a year later, he was doing great. We brought him back to the hospital to meet with the doctor, the oncologist we first saw. He was the head of the department. And, when we brought him back to see if there were any experimental treatments or protocols that had come up over the past year, this doctor was shocked to see my father walk in. And when he asked my father, what was going on, my father started talking about kale and collards and seaweed and brown rice. This doctor, his eyes rolled back into his head, changed the subject, wasn't interested, didn't want to know anything. And I was shocked because I thought this was magic. I'd never seen anything like this. And it was so bizarre to me and disturbing that this doctor was not interested. And so that was my portal of entry. I decided that there was value and there was something miraculous and spectacular happening. And my attention in my medical practice thereafter turned to nutrition.
It's an incredible story. Absolutely incredible. So you had a long-standing practice, and then you decided to go and do Ethos Health. You started Ethos Health. What is it, and how does it function?
Patients who are transforming their lives and need to live in a different way, need to think differently, feel differently, eat differently, need lots of time and attention. And in a conventional setting, in an insurance-based setting, in a conventional medical office setting, it is difficult to work out. So we left and we went to the farm, and we spend unlimited amounts of time with our patients, sitting with them, teaching them, educating them. They come to the farm. It is in a beautiful, natural setting where they can see how health is connected to the natural world through the methods of how plants are grown, and how basically the wonderful things that plants give us that reverse disease come out of soil that's taken care of in a certain manner. That's where the medicines come from, so that they can see how that relationship develops, how it gets into them, how it affects them. So that's really, it's a beautiful place to be on the farm, because it's a holistic setting. Right. Ethos Health is not just about human beings' health. It's about planetary health. It is about the health of the soil, the microbes in the soil, the health of the water, native species, the 140 different species of birds that there are, because, our substrate is, human substrate is the earth. And if that is not preserved, it doesn't matter, if we have diabetes or not. Our chances for survival are going to become diminished if we don't preserve our Mother Earth from where we come.
True holistic approach. It's great.
Yeah.
What type of patients do you see at Ethos Health?
Oh, we see everyone from before they're born. We see pregnant women who are concerned about contaminants in the environment and building a beautiful, healthy baby, to, our current eldest statesman or stateswoman is, let us see. She is 94.
So can you tell us what experience you have working with type 1 and type 2 diabetics?
Our eldest lady came to us at the age of 91 with diabetes for, about 15 years. And she rid herself of her diabetes within 2 weeks. And is now 94 and no longer she has normal blood sugars. So it just goes to show you age is no barrier to getting better.
Okay, so this is perfect. Suppose a new patient comes to you with type 2 diabetes, 55, 60, middle age, somewhere like that. Tell us exactly what your approach is to helping them transition towards a plant-based diet so they can completely reverse type 2 diabetes altogether.
Okay. Well, the first step is, they come into our office. We spend, typically we spend about an hour, at least an hour, downloading information from the patient, examining the patient, and going over their life for the first visit. And this includes some data collection, vital signs. We try to get an estimation of their visceral fat, their past medical history. And what ends up happening is we have a frank discussion with the patient, and what happens next is dependent on how engaged the patient is. So the sky's the limit if the patient desires it, is enthusiastic, and is dedicated. We offer our patients a program which is called the Ascent to Wellness, and subtitled A Year of Mindful Living. And the reason why it's entitled that is because we spend 1 year with the patients in this program, stay only, guiding them through the portal of entry to get off their diabetes drugs and whatever other drugs they're on, but introducing them to the plant-based foods, educating them, giving them cooking classes, teaching them how to, engage in fitness, evaluating their fitness level, all these things. And then the years spent making sure they're sustained in this process so they don't fall off and derail. So, so it goes from a simple construct to a very involved construct with a lot of individualized support for the patient. And that's that Year of Mindful Living program.
Now, this is great. Do you also see patients with type 1 diabetes as well?
From time to time, we do see type 1 diabetics. And what we tell them is that that plant-based whole foods diet is the best thing that they could possibly do, because it really revolutionizes the sugar control of a type 1 diabetic, and it basically changes their fortune, their life's fortune. And I believe, remediates the terrible risks for end organ damage that type 1 diabetics have.
People with diabetes, whether we're talking about type 1 diabetes or type 2 diabetes, a lot of them are, they shun away from eating any kind of food that contains carbohydrates. So they don't eat fruits, they don't eat potatoes, they try and stay away from beans or anything that contains starch. So what can you talk about that and give us an idea of whether or not people with diabetes should be avoiding starch in any way, shape, or form?
Yes. So, the primary thrust and trajectory of what we do in our practice, it doesn't matter if the patient has diabetes or any other disease or complaint. Always try to find the cause of the problem and remove the cause. The cause of diabetes, whether it be type 1 or type 2, is not starch. It doesn't cause diabetes. It never did. The cause of type 2 diabetes, we now know, in a 50,000-foot view of the forest, it's animal-based and sourced foods. And if you want to drill down on a more molecular level, it appears to be saturated fat. And it appears that this, which basically pretty much only comes from animals. I mean, there are a couple of rare instances in the plant world where you can get significant levels of saturated fat. But, it is basically a result of overindulgence in animal foods. So these saturated fats are toxic. They build up in muscle cells, and we now know that they are toxic to pancreatic islet cells. We have evidence that they actually kill them. And not only do they kill them off, And the islet cell is your cell in the pancreas that produces insulin. Insulin is a molecule that is necessary. It's like a key that fits into a lock in your cells to allow sugar to enter the cells and be burned. And if you don't have the capacity to produce these keys anymore, sugar starts building up in your bloodstream, and voila, you have diabetes. We used to think that was the we knew that was the case for type 1 diabetes, where you've lost your insulin producing or your key producing capacity. And of course, when you don't have these keys to unlock the doors for entry to glucose into the cells, then you have very high blood sugars. For type 2 diabetes, we have known for a long time that it's not primarily that mechanism. It is a mechanism where the locks on the doors of your cell that lets the insulin in don't listen anymore to the keys. You have plenty of keys that are floating around because a type 2 diabetic keeps pouring out more and more insulin as the cells, gateways or locks become more tone deaf. So that's a matter of insulin resistance. But we now know that the story is not that cut and dry, and that there are many type 2 diabetics now that have problems where eventually they're going to have difficulty producing insulin because their insulin producing cells are compromised. And the other situation is that these saturated fats also compromise the action of insulin at its targets. So we're still figuring all these mechanisms out, but the bottom line is if you want to avoid the causes of diabetes, they're animal saturated fats, type 2 diabetes. So it's not starch. I think that there are many different opinions on this, but in general, different foods have different glycemic indexes. They can cause sugars or insulin sugars to rise more rapidly, even in the plant-based world, when you ingest them. And in general, starches, the starch group tends to have higher glycemic indexes than other plant groups. So once people are in trouble already, eating a lot of starches could be problematic for them. But I have never, it is not the cause of the diabetes. And we actually have many patients who enjoy starches in moderate amounts. We have one patient, I can tell you the story, who actually cured himself, who was grossly diabetic, only eating starch and some plants, huge amounts of it. A few years ago, it was maybe about 7 years ago, I had a patient walk in who was a Hispanic male, he was very obese, maybe about well over 300 pounds, 320, 330 pounds. And the reason why he was coming into our urgent care walk-in center, this is when I had my old practice. And the reason why he was coming in was because for the past month, he'd been very thirsty, his vision was blurry, and he'd been peeing a lot. So upon hearing this, the first thing the medical assistant does is, check out his urine and do a finger stick on him, a glucometer reading. Of course, the sugar goes off the scale on the urine dipstick, and the sugar is so high when he checks his the glucometer reading that it just says over 400. It's higher than the machine can measure. So I didn't know what was going to happen to this gentleman. He never heard of broccoli before. So I told him, And it's kind of a crazy thing I'm telling him, right? That your sugars are so high, but you should start eating rice and sweet potatoes. You could have that and you could be better. So who knows? The other thing is that having extremely high sugars, even for a type 2 diabetic, could, if they get high enough, it could be life-threatening. So if this person was non-compliant, if I gave him, told him, here, do this, this, and this, eat so many greens, have the sweet potatoes, and if he didn't do it, and, you know, because a lot of people don't follow directions, and if I didn't give him the choice of having taken the drugs, he could end up dying. He could have ended up going into a situation which is called hyperosmolar coma, which is when a type 2 diabetic sugars get so high, the blood gets so thick with sugar that the patient loses his consciousness. And, you know, the people like this have to be admitted to the intensive care unit. So I was crazy enough to basically give this man the choice. And he said, okay, I'll take the plants. I said, okay, I could give you drugs, and I know the drugs will knock down your sugars right now. Or I could give you the plants. He says, give me the plants. I said, very good. I said, but you have to follow my directions exactly. I don't want you, if you don't follow these directions to a T, you're going to be in big trouble. He said, okay, I promise. So I took a pencil and a white piece of paper. I wrote down everything that he should do, which is, it basically translates to today what is we call it Dr. Weiss's 30-day challenge. It is the portal of entry for our year of mindful living. And basically what it consists of is unlimited starches. We picked three starches for the gentleman. Sweet potatoes, in his case, it was like sweet potatoes, steel cut oats, and brown rice. As much as you want to eat, whenever you're hungry, help yourself. I didn't care if it's 10 plates a day, help yourself. But in addition to this, the person has to have 16 ounces daily of dark leafy greens, preferably raw. Things like, kale, collards, mustard greens, stuff like that. Unlimited amounts of fruits with a lot of fructose in them, right? As much as they want, and water, and that's it. So I said goodbye to the gentleman. I said, we taught him how to use a glucometer because he didn't know what diabetes was, and he didn't know what a glucometer machine was. We gave him a sample in our office. I said, here's what you do. We made sure he knew how to use it. And I say, you write down your sugars before every breakfast, before every lunch, before every dinner, 3 times a day. And you come back to me here in 1 week. And I said, if something goes wrong and you start feeling, if your condition declines, you call 911 and go to the emergency room. So the next day, I come into the office, and on my desk, there's a note that LabCorp wants to speak to me because there's a panic value. There's an extreme value. And my heart sinks because I guess I know who this is. The lab was calling me up directly. They didn't want to wait to send the paper report to me. The pathologist was calling me to tell me that this gentleman's sugar was 760, which is a danger kind of sugar. These are the kind of people who go into hyperosmolar, non-ketotic coma, who must be admitted to the hospital. And I started to turn white. I guess whiter than I am. Well, I'm kind of yellowish because I eat a lot of carotenoids, but I enlisted all of my office staff to get this guy, contact him. And basically we kept calling, his cell phone didn't work. We kept calling his home phone number. There was no answer. Sent the police to I figured he's lying dead on the floor of his apartment or like delirious and non-responsive. Sent the West New York police to his apartment because we had his address. They're knocking on the door, no one, they can't find him, they give up. We call him, a couple of more times over the past few days, can't find him. 7 days later, he walks into the office. And I said, what happened to you? He said, oh, I didn't know you were trying to call me. My phone had trouble. I said, how do you feel? He said, I've never felt better in my life. I feel fantastic. I said, we put him on the scale. He had a high blood pressure normal. In 7 days, he lost 12 pounds. Okay. I said, were you taking your sugars? I said, let me see your sugars. And the sugars told this story. And by the way, I said, what were you eating? I said, I ate a lot of sweet potatoes. I ate 3 sweet potatoes a day. He said, I ate 2 bowls of oatmeal every day. I said, did you eat the greens? He said, yes, I ate the greens, but I ate all those starches as well. His sugars, the trajectory of his sugars read something like this. 24 hours later, he started to get readings in the high 300s because the glucometers can't really accurately measure above 400. So high 300s. And then 48 hours later, it went into the high 200s. 72 hours later, it went into the high 100s. 4 days later, it went into the mid 100s. 5 days, 6 days. By the 6th or 7th day, his sugar was 100, and which is basically normal. On no drugs, lost 12 pounds in a week. That's what a plant-based diet does for diabetes.
So given this experience, after that week-long period, did he continue to apply this method because he saw how beneficial it really was?
I made him come back in another week to follow him up, okay? And he did. His sugars went down into the 90s. I think the second week, he still lost another 10 pounds. I think within 2 weeks, he was down 22 pounds. I saw him at a month. He was doing great. I saw him at the second month doing well, then lost the follow-up. It was difficult in my conventional practice, other than me doing hand-to-hand combat with the patients in the room, all the education, other than giving them reading material and other kinds of hard materials, revolved around me meeting with the patient in the room. And the beautiful thing about the farm setting is we have a whole team. So the team gets embedded with the patient. The team is taking the patient to the supermarket. The team is taking them out to eat to teach them. The team is, calling them. If it takes, constant support, reviewing logs, all kinds of things. So it leads to more sustainability in patients continuing. One of the most difficult part in behavior change, in reaching health goals, is it's sustaining the behavior. It's not thinking about doing it, which is called contemplation. It's not preparing to do it, and it's not actually diving in. It is once you've seen the light, it is sustaining it. That's called the trans-theoretical model of behavior change. And it's a well-documented theory of how people can apply and continue to be compliant to, healthy behavioral changes.
Okay, so this is actually a really important point because there are a lot of people who do make a transition towards a plant-based diet and they see the benefits of it. That maybe they lose weight, maybe their blood glucose normalizes, maybe they gain energy, maybe all of the above. But then somewhere down the road, 3 months down, 4 months down, 6 months down, 12 months down, they start to revert back to their old habits.
Yes.
So how can you promote long-term habits so that they actually are less likely to go back to their old ways?
They have to have a deep educational foundation so that they understand where the difficulties are, where this submerged rocks are that they're going to hit, and they know them when they hit them, and they understand what to do. One of the tools is being mindful of everything they do. It's a mindful approach of what they are doing, why they are doing it, and how they are doing it. And that mindfulness occurs whether they are picking up a package of food in the store and making sure, you have to be mindful to the nth degree to make sure there are not diabetogenic ingredients getting into your foods. And I can't tell you, it takes it takes a journey. People can read articles on how to read labels. You can take them to the store and read them in front of them. But we often see a year later, it's hard. People still have difficulty. They're not biochemists, and they'll be reading something and pick up something that says, monoglyceride, diglyceride, something like that, and whatever. It slips by them and they're eating it. Sure, it's a trans fat that helps to cause their diabetes. So it's a process of constant re-education, constant adjustment. The other major thing that people must be aware of in making life sustainable on a plant-based diet is the acknowledgement and existence of the pleasure trap in all of us. The pleasure trap as coined by my favorite, Doug Lyle. And the acknowledgement that food is basically a drug to me, to you, and to everyone. No matter how many boundaries you have and how contained you think you are, eventually these drugs call our names. And I think that's a primary reason why people tend to derail after doing it for 6 months and after doing it for a year. Even though they see the value, that pleasure trap has the power of an addictive drug. And these drugs are so ubiquitous in our supermarkets, on the corner store, and in fast food places. You're driving by 10 of them every block. That it would be like if you've tasted cocaine once and you have to drive down the street and there's a crack salesman on every corner. It's really difficult to drive by those corners without getting some cocaine. So I think that's basically what happens. It takes constant support for the average individual to make sure they keep driving and don't buy that cocaine. That's what it ends up being. So that's why our program, I think, is successful in doing that.
So you talked about this was covered a little bit in an article on the Forks Over Knives website where you were working with a woman named Joyce.
Yes.
Type 2 diabetic, getting off her insulin. Can you just talk about, as a doctor, your approach to getting people off their medication? How fast do you do it?
Yeah.
How does that work?
Well, she was a particularly amazing story. And the reason why she was so amazing is I had never seen a human being on that much insulin before. Just to give people who don't know insulin, just to understand how much insulin she was taking. So she was being treated by an endocrinologist for many years who, I guess she had had diabetes for about a decade, treated with insulin and oral drugs because the oral drugs weren't cutting it. Then the insulin wasn't cutting it. She had been up to 150 units of Lantus every night, plus 3 different shots of Humalog of shorter acting insulin with every meal. And her sugars, she had a hemoglobin A1C on that regimen. And for people who don't understand hemoglobin A1C, that's the sugar averaging, that's the most accurate long-term test that runs over 3 months to show how much sugar coating you have in your red blood cells. And it's really a good way of showing how controlled your sugars are. Hers was like 12 on the maxed out insulin level, maxed out 3 shots daily of regular insulin, and maxed out pills. I did not know this was humanly possible. So, and her sugars were still on that regimen. They were 300. What do you do with a lady like this? Give her sweet potatoes.
I love the response.
She came in. This lady is a nurse practitioner, and she came in. Her name is Joyce. You can read her story. She's one of the most wonderful people you'll ever meet. She came in to us, and she said, whenever people come in to see us, they have to fill out an application first in order to see us so that we can get all of their personal information. And one of the last questions we ask is, what is your goal in coming here to see us? And she wrote as her goal, her desire is she wants to someday go back to become a nurse practitioner to help people again. She was so critically ill, she was on disability. She had to quit, and she couldn't, because she had many other problems, including horrible ulcerative colitis, almost died several times from pulmonary emboli, a lot of different problems. The diabetes was one of the least of her problems. So when she said that, of course, she had never heard about plant-based whole foods. She's a nurse practitioner who treated diabetes. She's looking at all this insulin is on, and I said she's going to eat rice and sweet potatoes and greens, and she was looking at me and a little surprised. But she believed in what we were saying, and she was dedicated. Over day 1, day 2, day 3, day 4, her sugars rapidly plummeted so quickly. And we're, based on our experience, we're kind of prepared for this. It's very dangerous when you're having someone who's taking insulin. Someone who's only on oral agents, on pills for diabetes, I just immediately stop those as soon as they begin the 30-day challenge, the beginning of our program, because I know that the foods we'd be working in a day or so, and I know they'll be effective, so I'm not worried about their sugars going up once they immediately stop the medicine. But I was very concerned about this lady because she was on such massive doses of insulin. And even if someone is on moderately large doses of insulin, the plant-based foods work so quickly, like within the day, 2 days, that they could become a person who's taking insulin and eating the plants could get a sugar of 30 or 40, black out while they're driving, fall down the stairs, break their neck. So I immediately, as soon as they start, I hedge my bets, and I immediately, maybe depending on how much insulin they're on. For Joyce, I told her to drop her Toujeo, this powerful supersaturated insulin, from 150, I believe, to 130 or 140, cut it by about 20 units. And she was constantly monitoring her sugars 3 times a day, was calling me several times a day. And in the first week, 2 weeks, 3 weeks, we were monitoring her sugars and giving her directions a couple of times a day, sometimes dropping insulin 2 or 3 times within the same day. So rapidly did her sugars come down. And believe it or not, by the end of the month, I'd have to get the exact time frames, but she was almost off all of the insulin. We stopped all of her oral agents on the first day of the challenge. And within, I believe it was 5 weeks, she was on no more insulin whatsoever.
You got her off of all insulin in 5 weeks after having taken more insulin than anybody you've ever seen in your life.
Yes.
That's incredible.
And more than was recommended by the manufacturer. And and her sugars at the end of 5 weeks, on being on no diabetes treatment other than eating plants. Of course, she is one of the individuals we had to be very careful with starches with, because she had high levels of visceral fat and she was sensitive to them. She did very well on the 30-day challenge, but going forward to continue her diabetic and weight improvements, we thought it would be best to limit starches in her. But they worked fine in the first stages. And, her sugars at 5 weeks were in the low 100s, like averaging 100, 110, on nothing other than eating plants, 115, maybe sometimes 120, between 100 and 120. I think back to the days in medical school where, they said things like this are not, you just have to keep, that's right, you have to keep managing these things, just keep giving people medications. You can't help them reverse it or cure these things, and it's not true.
Yeah. And I read in the Forks Over Knives article, she also got off a lot of her other medications. She was on over 15.
She was on 24 medications.
Yeah.
She was on ulcerative colitis, which she almost died from. She was off all medication, on enemas, on oral medications for years, active within a month, she was off all of them. All of her massive pain medications off of them.
This is great. Let's talk about another thing that's really important is for the link between type 1 diabetes and dairy. Can you talk about that?
Yes. Well, we have evidence that comes from studies that were done in Europe a number of years ago that linked the consumption of milk protein that was given to babies early on in their life to the development of type 1 diabetes in babies who had relatives in prior generations or in the same generation that had diabetes. So in other words, giving milk to a baby who is genetically predisposed caused quite a lot of type 1 diabetes. So we know that there are antibodies that develop in such individuals to milk proteins and now to something called bovine insulin. It's insulin that comes from the cow is actually present in the milk, and that the babies or the child or young individual's immune system starts launching missiles, antibodies to attack these, what they see as foreign materials or enemies. And while doing so, these same missiles take out, unfortunately, and kill the insulin-producing islet cells of the young person's pancreas. And then they are left with a non-functioning pancreas. They have no ability to make insulin anymore. And, type 1 diabetes ensues. So, yes, that's a very powerful piece of evidence that we have.
And is that also true of products like cheese and yogurt and ice cream? Does it apply to all dairy products, or is it only specifically milk?
Well, I'm guessing so, because they're made of the same constituents. We don't give young babies cheese in general or ice cream. They're just drinking formula. So, a cow's based formula or breast milk. Well, in these cases, the study formula. So, but yeah, they're made of the same harmful constituents. So you can recognize type 1 diabetes as an autoimmune disease, right? If your immune system is launching antibodies or missiles against what it perceives to be an enemy, and you part of your body is taken out in the crossfire, that's called an autoimmune disease. And there are other autoimmune diseases, as people may be aware of, like rheumatoid arthritis and lupus, other things like psoriasis and ulcerative colitis and other kinds of very serious illnesses. And what I've noticed in my clinical practice is, sure enough, milk and cheese and dairy products, more than any other kind of animal food, can bring on an acute flare of these autoimmune diseases as well. So just to go back to what your question was, you asked, can cheese, and I think that milk and the dairy products are public enemy number one in general on the subject of autoimmune diseases.
It's perfect. Okay. So if somebody comes up to you and says, Dr. Weiss, I have diabetes, give me your recommendations for exactly what to eat. If you had 60 seconds to basically just tell them one thing, what would it be?
I would eat a diet made out of whole, unrefined plant foods. I would tilt that diet towards a lot of dark leafy greens. That's the most important component. I would make sure to eat a lot of vegetables, yellow, green, and otherwise solid vegetables. Help yourself to fruits. Make sure you have legumes, lentils and beans, and also partake of starches as well. And it depends what kind of, what you're using to treat the diabetes, whether it's maybe just diet controlled or with oral drugs or with insulin. But particularly if you're on the medications and particularly insulin, you should be under a doctor's care who is willing to work with you to relieve the drugs in a responsible manner so you don't get into trouble. And when I say getting into trouble, there is a concern with your sugars dropping too low because the plant foods that you'll be eating are so powerful that if you're taking them with the medications, you could bottom out your sugars, and that's dangerous. I forgot, of equal importance is the cessation of all foods that come from animal origin. Stop them. And all processed foods.
It's plain and simple.
I think maybe that was 1:30, but.
Okay, there's so many good nuggets in there. I'll take it. So the last question here is, when are you going to invite myself and Robbie to the farm to eat? Because I'm getting hungry just talking about it.
Tonight. Tonight, take the red eye from LA. I'll be waiting for you at Newark International.
Done. We're there. We're there. Well, thanks for taking the time.
You guys are welcome anytime.
Thank you so much.
Come at any time if you're ever in the New York metropolitan area. We're about an hour west of Manhattan, due west. And, we're open all through the winter, anytime. It's beautiful at any time, any season.
Perfect. This has been really fun to understand your perspective and your work with Ethos Health, because there's so much positive change that you're promoting. And it's really incredible to see that you have such success, not only with diabetes, but with hypertension, with high cholesterol, with autoimmune diseases, with weight loss. And so we totally appreciate your time in speaking with us here today.
Oh, it's my pleasure and an honor. I feel anything I can do to get the word out and to help people realize that they don't have to be sick all the time. They can be well. And it's within their power and their desire to do it. It's my pleasure.
Thank you again. I'm looking forward to seeing you at the farm and eating some fresh fruit.
I do too, Robbie. I look forward to seeing you soon.